Good afternoon again. You're the Senate Finance Committee. It's still Tuesday, January 21st. We're only an hour late starting 3 bill hearings, so we're going to start with Senate Bill 224. Alyssa Lord is here for the Opioid Associated Disease Prevention and Outreach Program, Appeals and Membership of Standing Advisory. Thank you.
Good afternoon, Madam Chair, Vice Chair, and members of the committee. My name is Alyssa Lord, and I have the privilege of serving as the Deputy Secretary for the Behavioral Health Administration at the Maryland Department of Health. Thank you for the opportunity to testify today in support of Senate Bill 224, Opioid-Associated Disease Prevention and Outreach Programs, Appeals, and Membership of the Standing Advisory Committee. This bill seeks to make a technical modification to the existing legislation that will enable a local health department or community-based organization to appeal to the secretary or the secretary's designee regarding the outcome of an application for the authorization to operate an opioid-associated disease prevention and outreach program, as well as the secretary or the secretary's designee to serve on the Standing Advisory Committee. This legislation will transfer responsibilities currently held by the Deputy Secretary of the Public Health Administration to the Secretary of Health or the Secretary's designee. This transfer of duties will allow for the Secretary to assign these responsibilities as necessary in the future without requiring new legislation. The state currently operates close to 100 opioid-associated disease prevention and outreach programs across the state. With this proposed revision, there is no anticipated operational impact. This technical change allows the department to align across the other designated functions of the Secretary. MDH promotes and enhances the health and safety of all Marylanders through disease prevention, harm reduction, access to care, quality management, and community engagement, and opioid-associated disease prevention and outreach programs are a critical tool in addressing Maryland's response to the opioid epidemic. In summary, this revision to the legislation positions Maryland to respond more effectively to the opioid crisis by centralizing authority, leveraging specialized expertise, and ensuring operational excellence. Thank you for considering this important legislation, and I'm happy to answer any questions you might have.
Thank you. Do I have any questions? We have a question from Senator Lamb.
This was the health occupations bill, right?
No, sir.
All right, sorry, wrong bill. Oh, wrong bill. All right.
Listen, I do have a couple questions. Just what's an outreach program?
So those are located within a local jurisdiction, and it can include education, programming in the community, access to various different types of services. It can be going into the community to provide services. It can be services offered within a community-based organization.
Is it treatment? That's really my question. Is it treatment?
It is education programs. I can send you under the regulations what defines the specific definition of the outreach program.
And the reason I'm asking is I want to make sure that we, as a state, are doing the proper oversight to treatment facilities, the grants that we give for treatment centers. That's why I'm asking, is treatment included in this outreach?
So what it states is that, let me get to the exact description. A program shall be designed and maintained to provide security of program locations and equipment in accordance with regulations adopted by the department, be operated to allow participants to obtain and return hypodermic needles and syringes at any program location if more than one location is available, include appropriate levels of staff expertise in working with individuals who inject drugs, include adequate staff training and providing community referrals, counseling, and preventive education, provide for the dissemination of other preventive means for curtailing the spread of HIV and viral hepatitis, provide linkage to additional services, including substance-related disorder counseling, a treatment and recovery services, testing for HIV, viral hepatitis, and sexually transmitted diseases, reproductive health education and services, wound care, and the services of an overdose response program under Title 13. I can go on if you would like. Okay.
That's fine, Alicia, thank you. Do I have any other questions from the committee? Thank you. That ends the bill hearing on Senate Bill 224. Thank you. Next, we're going to do Senate Bill 217. Sarah Case Heron is going to come up. And Sarah, are you bringing all the other boards with you?
If we may.
Are they all going to speak?
They do not need to briefly, but it may be helpful to have the Board of Massage Therapists speak because they have a technical change as well.
Okay. Sarah, you can have as much time as you need. Anyone else that speaks gets 2 minutes, okay? Thank you.
Thank you. Good afternoon, Chair. Do I have it on properly? My apologies. Good afternoon, Chair Beidel, Vice Chair Hayes, and committee members. I'm Sarah Case Heron, the Director of Governmental Affairs for the Maryland Department of Health, speaking on behalf of Senate Bill 217. This is an omnibus departmental bill for the Maryland Department of Health that includes sunset extensions for 4 of our health occupation boards and also increases the membership on the board of directors for massage therapists. I'll provide a brief overview and then let the boards who are present here speak to any changes or questions. The Professional Counselors Board sunset extension extends the termination provisions related to the statutory and regulatory authority of the board for 5 years until 2031. The Board of Audiologists, Hearing Aid Dispensers, Speech Language Pathologists, and Music Therapists sunset extension extends the termination provisions related to the statutory and regulatory authority of the board for 5 years. The Board of Pharmacy sunset extension similarly extends the termination provisions related to the statutory and regulatory authority of the board for 5 years until July 1st, 2030. The Board of Massage Therapists sunset extension extends the termination provisions related to the statutory and regulatory authority of the board for 5 years until 2031. And additionally, the Board of Massage Therapists board membership provisions increase the board of directors by one licensed massage therapist and 1 consumer member for a total of 9 members to represent the number of actively licensed massage therapists, which lead to, they believe, more informed and effective decision-making, as well as maintain an odd number of members to avoid tie votes. We're respectfully requesting a favorable vote on this bill. Thank you.
Thank you. Who else would like to speak?
Good afternoon, Madam Chair, Vice Chair, and members of the committee. Thank you so much for this opportunity. My name is Karen Katrinik, and I'm on the Board of Professional Counselors and Therapists. I'm here to share that our board suggests and would support us passing this bill in order for us to maintain our mission of protecting the public, credentialing, licensing, investigating complaints, and discipline. We're very much passionate about serving the public, and we've had struggles with not having an executive director for a few years, but we have a new one starting in a few weeks, so we're really excited about that. And we're just working really hard to not let any holes in the cracks. But we thank you for the time, and I'm happy to answer any questions.
Madam Chair and members of the Finance Committee, good afternoon, and thank you for the opportunity to testify in support of Senate Bill 217. My name is Sharon Oliver. I'm the Executive Director of the State Board of Massage Therapy Examiners. In 2016, the Assembly established the State Board of Massage Therapy Examiners, and this is the board's first sunset. And since its inception, the board has accomplished numerous goals and objectives to improve the quality of massage service and to protect the public health safety for the citizens of Maryland through collaborative efforts with various state and national stakeholders. Maryland has elevated the educational standards and required training for massage professionals, increased access to massage care, by increasing the number of licensed massage therapists available to work in healthcare settings, and improves public safety with the enactment of legislations in 2022, 2023, and 2024. We are the first massage board in the nation to enact a law making it a felony to aid and abet the unlicensed practice of massage therapy, providing law enforcement with a much-needed tool to combat illegal activities in massage businesses. Since the enactment of this law in 2024, 2 counties have reported to us that they have charged at least 3 cases each. The board continues to improve internal operational efficiencies to ensure timely processing of licensure applications and to increase the workforce. We now accept online applications and payments and transition from in-person to online administration of our required examination. And in so doing, we've reduced the application processing time by 20 days as applicants are now able to take examinations in their home. The board has no outstanding legislative audit deficiencies and respectfully request a favorable vote on SB 217. Thank you.
Thank you, Ms. Oliver. And finally,
Good afternoon, Madam Chair, esteemed members of the Finance Committee. Thank you for the opportunity to testify in support of SB 217. Over the last 10 years, the Massage Board has experienced an increase in the workload for our committees, especially the disciplinary and legislative committees. It has become necessary to increase the number of board members to ensure ethnic and geographical representation and operational efficiency and effectiveness. The Disciplinary Committee works tirelessly to ensure the protection of the public through the timely processing of complaints received. In fiscal year 2023, 31 cases were adjudicated, 47 in fiscal year 2024, and to date in fiscal year 2025, 29 cases. We anticipate in excess of 50 complaints for fiscal year 2025. The increase in board members would allow for a more even distribution of the workload and diverse perspectives to make decisions. The board is sensitive to the impact of cultural differences in the practice of massage professionals, and to that end would welcome diversity of thoughts from representative practitioners during its deliberative processes when adjudicating cases. It is important to continue to evolve our regulatory oversight as the industry grows and changes. Expanding the board provides stability and continuity for the industry, allowing practitioners to operate within a clear regulatory framework. A larger board can engage in long-term planning and policy development, ensuring the industry adapts to changing circumstances and remains well-regulated. Ensuring a quorum is essential for the board to function effectively. A larger board can maintain a quorum even during periods of vacancy, ensuring continuous and effective governance. Continued oversight helps maintain high standards in the massage therapy industry, protecting both practitioners and clients from unqualified or unethical practices. The board can better manage the increased workload and enhance its effectiveness.
thank
We
you.
respectfully request a favorable report.
Thank you. And we have one more person that's joined the table.
Good afternoon. My name is Keena Stevenson. I'm the Executive Director representing the Board of AHM, also known as the Board of Audiologists, Hearing Aid Dispensers, Speech Language Pathologists, and Music Therapists. The Board does request a favorable report on behalf on the Bill of 217 to extend our sunset legislation. We currently serve over 6,100 licensees. We provide the services of licensure as well as discipline. Our board currently also has a significant economic impact of over $200,000 in revenue for licensing expenditures. For those stated reasons, we do request a favorable report on behalf of 217.
Thank you. Do I have any questions for this panel? Oh, Senator Lamb? Sorry, one more. Will you come sit here at this end?
Here.
Okay. You can start.
Oh, is it on? Okay. Good afternoon. Dina Spates Napata, Executive Director of the Maryland Board of Pharmacy. The evaluation conducted by the Department of Legislative Services in October 31st of 2011 recommended the board sunset date be extended to July 1st, 2023. Subsequent to that, an emergency bill was introduced during the 2023 session to further extend the sunset date. In accordance with Senate Bill 217, the board agrees with the sunset recommendation, and we urge a favorable vote on Senate Bill 217. Thank you.
Okay, now Senator Lamb, your question.
All right, thank you, Madam Chair. I always appreciate the opportunity to kind of look at some of these boards during the sunset extensions that come up periodically. I've been hearing a bit about the Board of Professional Counselors and Therapists, and I think since we have this opportunity to look at the sunset extension, just wanted to understand kind of the stability that the board has, and if you can tell me how many directors this board has had over the last 6 or 7 years, can you illuminate us on that?
Well, we lost a director, I think, maybe 2 years ago, and since then we've been not having a steady director. But we've had one of the staff people on the board who is in charge of investigating discipline and like an investigator. She kind of took on the lead. And our chair of our board also does way more duties than she used to. And the staff has been unbelievably devoted. The short staff that we are, we had not enough people, and we couldn't hire people that would wanted the job. Then we needed the pins. Then they finally got the pins, and now they got the people. So literally next week or the week after, we're having a deputy director and an executive director join us. But we've been, I feel like we've been really, really conscientious about not letting anything slip, not letting too much time go by when somebody calls, making sure that the cases get investigated in a timely manner. And I can really assure you that every member of the board and the staff is working, and we're really hopeful that this next generation of leaders are going to help support us to create more stability. But it is what it is, and that's what we've been through.
So your board has been without a director, though, for the last 2 years?
No, we had one. He lasted 2.5 weeks. He came from Chicago, and he literally quit in 2.5 weeks. Then we had no one, and then we had another one who thought he only had to come like 4 hours a day. And it was very, even though we explained the job, and there was a whole panel that did a search committee and told him exactly what's required. So we had some odd situations happen with people we've hired.
So you mentioned that staff have kind of picked up, some of the board members have helped with some of this too.
The staff and then board members volunteer and go in on days if there's a backup of like things that need to be covered. But there have been some key staff people that have been there for a long time that we're grateful to, that have really.
On that point, how many staff vacancies do you currently have?
I'm not really sure. I think right now we got the pins, so I understand that everything's been happening in the right direction, but last year was really a challenge.
Can you give us a ballpark of like 50%, 75% staffed?
I'm going to guess 75% now, but
Okay.
it was probably down to 60.
Oh, so there was a period where you had no executive director and you were only 60% staffed.
There was.
40%
There was
vacancies.
for a brief time, because we couldn't get many things we needed from the state in terms of being able to hire people.
And you talked about new folks coming in through the executive director position. Is the new person coming in now, starting in a week or two, do they have any prior experience with any health occupations boards in the past?
I don't know. I'm not on that. I wasn't on that committee. I'm on the legislation committee, so I'm not aware.
But you're
of
on
that.
the board, right?
Yeah, but I have it in my phone, but I wouldn't want to speak unless I looked it up. I've read it. I've read the resume, and they definitely have experience. In my mind, I thought this looks great, but I didn't memorize it.
So not sure if they have health occupations board experience previously.
No, I'm so
if you can
sorry,
get back
I
to
don't.
us on
but
that.
I'm happy to look it up and email you or something, because I don't know that.
Okay. Because I assume the board voted to accept this new person.
We did, and we all read the resumes and we all talked about it, but
Okay.
I don't remember because I'm got too many things in my head, maybe.
Okay. If you can let us know and get back to us on whether that person
Absolutely.
has had any prior health occupations board experience, that'd be great. Thank you.
Thank you.
I don't see any other questions for this panel. Thank you. We have someone else that was signed up to testify. Ann Seacott is Ann. There she is. There's Ann.
Go by the one with the light. Thank you. Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. I'm Ann Seacott, and I'm here today representing two organizations, the Maryland Association for the Treatment of Opioid Dependence and the Maryland Addiction Directors Council. We're here in support of Senate Bill 217 with an amendment, and our amendment is to request a shorter sunset review for the Board of Professional Counselors and Therapists. We very much appreciate the challenges that the board has been facing the last few years, and we are very appreciative of the dedication. We're excited that there's going to be a new executive director and deputy director, so we're very happy for that. But I just need to explain why we are asking for a shorter time frame, because it's really the #1 complaint I hear when I go to these association meetings is how long it's taking to get applicants' certification requests approved. And it's taking 6 to 9 months is what the anecdotal information is that I'm hearing from providers. And they also express some frustration with the inability to really get any kind of response when they reach out to the board staff with phone calls. They have to call several times before they're able to get any kind of response. This kind of stuff is, we know, it's very likely contributed by workforce problems, but it is creating or adding to the workforce problem in the behavioral health field as well. And it makes it difficult to hire. There are programs that are required to have certain numbers of certified and licensed staff, depending on the size of the program. And it makes it very difficult to maintain quality, to make sure they've got the positions filled. And on occasion, the Behavioral Health Administration has cited programs for not having all the certifications renewed as they're supposed to be. So these organizations stand ready and willing to work with the board and especially their new leadership.
Thank you. Do I have any questions for Ms. Seacott? Seeing none, thank you for that information. So that ends the hearing for Senate Bill 217, right? Yes. Yep. And our last bill of the day is Senate Bill 69, and we have Senator Salling with us. Thank you.
Thank you, Madam Chair, Vice Chair, and the members of the Finance Committee. For the record, my name is Senator Johnny Ray Salling. I want to thank you for this opportunity and testify in Senate Bill 69, Maryland Department of Health Access to Telephone Study. This bill will require the Maryland Department of Health to conduct a study to determine the visibility of each resident having access to a phone who are patients in psychiatric or assisted living facilities and nursing homes. The study will assess the potential cost of installing and maintaining phones systems in the facility, including but not limited to labor, equipment, and installation. The study will investigate the benefits of patients having access to telephones, including but not limited to social interaction and access to support services. They can get a hold of their attorneys, get a hold of physicians, get a hold of social workers. The study will also include interesting parties such as representative from the assisted living facilities, nursing homes, also advocacy organizations for seniors, individuals with disabilities, and individuals with health and mental illnesses, also residents and their families. Current federal and state code indicate that a patient in a long-term care facility must have reasonable rights to phone access. There's certain stipulations only guarantee a minimum of 2 current used phones throughout the facility for all the residents to use. This does not guarantee every resident will have access to a phone every day, nor does it guarantee the privacy promise in the residents' rights Bill of Rights. State code also say that a resident is only guaranteed a phone jack or adequate wiring for a direct line in their room. The physical phone itself must be provided for the patient and their family. It's a critical situation. A landline provides reliable communication during emergencies, so they may easily reach out to medical staff or security or other emergencies. A landline in private rooms will help maintain confidential communication between patients and their caregivers or health care providers. It would also provide the overall quality of a patient's care, which can contribute to positive experience for patients and medical facilities. I want to add that I have discussed this with the representatives of the Department of Health, and I'm happy to add any amendments or any physical note that we can make such changes, such as making it a study or work group. And I'm currently working, or waiting, that is, on their input, which is why I have not added an amendment to it yet. I've also had, just to say, my parents were in some of these facilities as well. And they didn't have the access to any type of communication whatsoever. So we literally took my parents out and brought them to my house for them to live there instead of living in a facility that had no communication at all. So I do appreciate your time, Madam Chair and Vice Chair and committee. And I respectfully hope that you can move favorable in this report. And I am open to any questions. Thank you.
Thank you, Senator. We do have one virtual witness for your bill, and then we'll have questions.
Thank you.
How's that? Okay.
Yes, ma'am.
So, Mr. Seth Miller, right?
And I respectfully hope that you can move favorable in this report. And I am open to any questions. Thank you.
Thank you, Senator. We do have one virtual witness for your bill, and then we'll have questions. How's that? Okay.
Yes, ma'am.
So, Mr. Seth Miller, right?
Good evening, Madam Chair and Committee. Seth Miller, favorable with amendments. First, thank you for your service. Sir Stelling, thank you for taking this
report. And I don't have any questions.
Mr. Miller, you have something else playing the same in the background? Do you have
Madam Chair and Committee.
Zoom on or something?
Madam Chair and Committee. First, thank you for your service. First, thank you for your service. Sir Stelling, thank you for taking
I think you have Zoom on where you were watching the meeting. Do you have your, did you have your Zoom on so you could watch the meeting? In the background? In the background? Zoom on or something?
I think you do have Zoom on. Oh,
Or is your YouTube stream, you have YouTube on?
this is getting very frustrating. I apologize profusely.
Zoom, watching the meeting?
Yeah,
Did you have your Zoom on so you could watch the meeting?
yes, I did. I received a notice of it.
Okay. Have you turned it off now? Your YouTube, you turned it off? YouTube
I think that's what it is. I apologize profusely. All right, now can you hear me more clearly?
We can still hear this.
We can still hear your second, whatever your audio is that's on, your YouTube or whatever you have on.
I think so. Can you hear me more clearly now?
I think so. Maybe not.
All right, now can you hear me more clearly?
Yeah, ask him, is it on?
Now, this should be better. Madam Chair and Committee, first thing,
Audio is that's on.
this is very frustrating. I think so. Can you hear me more clearly now?
I think so. Maybe not.
If I had $1 for every time I had technology problems, I would be wealthy. Madam Chair and Committee, first thank you for your service. I respectfully request a favorable report with amendments. Thank you for your service. Sir Sally, thank you for taking up this cause when my former senator did not. I made one site increase staff after waiting 2 hours to be taken off a bed pad. It would cost less to get the ladies who took care of me that needed help, the defendant complaint, the defendant complaint to counsel. I have my iPhone. Senator Sally, thank you for I apologize profusely for what happened with your father and falling in urine. You are a better man than I am. I'm not an attorney, but I would hire one. At Potomac Valley Nursing and Rehab, I did not have full use of 3 of my 4 limbs. I saw a paraplegic roommate attacked by a third roommate on the first night. When the nurse did not want to call police, I called police the second night, and I made the nurse call the police the first night. I have a copy of the police report. I discharged before COVID. The Washington Post reports that during COVID, Staff did not isolate known positives and accepted negatives. 10 admitted negative contracted COVID-5 died. MDH funded the site. If MDH had listened, when I complained about the attacks on my friend, the team would have gotten it together and those 5 would be alive. Patient-provider communication will nip problems in the bud and cut costs. I sent a study. The fiscal note is for state sites. Private places poorly treat patients with mail order's money through Medicaid, Medicare, and exchange. Per Governor Moore's October call for patients to self-advocate, I want this study and non-forensic patients in private sites given phones, if possible, under USAC, or the Universal Service Access Company subsidy, by the FCC. Bills for phone and cable could cause constituent complaints. Look at your phone bills. You pay a tax for this. Sites should make up the difference with the right of private action, and attorneys' fees should be paid for OAG, MDH, patients, providers, and families, and even insurance. I paid insurance premiums by phone. Inpatient insurance are natural enemies. Iron sharpens iron. I do not want what happened to my poor roommate, Brian Benjamin, to happen to anyone else. Would the governor want his mother, who was at his inauguration, treated like that? Leave no one behind. Thank you, Madam Chair, and I apologize for the technical problems. Senator Salling, thank you for championing this issue.
I'm glad we could hear your testimony. Thank you, Mr. Miller, very much for your testimony. That, do I have any questions from the committee for Senator Salling or Mr. Miller? Senator Hershey?
Senator, thank you for bringing the bill in. Just a quick question. There was a letter from the Department of Health that came in a letter of information. Have you gone through that letter and talked to them? Because it seems like some of these telephones are already required. And obviously, I want to make sure that if they are required and they're not being provided, is the department aware of that? And do they have any type of process to monitor and make sure that the requirements that we've already put in place are being held and lived up to?
Thank you, Senator. We did have a meeting. We talked in my office. They're more of state ones that are run. I think they are, but there's others that are not. So we're trying to find areas where we can help out that they don't have them. And so those studies will cover more than just the state ones. They will cover others as well. So I think that's probably why some of them do have them. But again, there's a lot of them that I know that are out there that don't have any communication whatsoever. And that's the reason why I'm doing this, but I appreciate that.
Okay. Again, I appreciate the bill, and thank you very much for that.
Thank you.
Thanks.
Thank you for that, Senator. Seeing no other questions, that ends the hearing on Senate Bill 69. Thank you.
Thank you, Madam Chair.
And that ends our hearings for today. I'll see you all 10.
I don't get to sleep in.
I don't get to sleep in, so you don't get to sleep in.